Welcome to the Macmillan Report. I'm Marilyn Wilkes, your host, and our guest today is Professor Jennifer Ruger, an associate professor at the Yale School of Public Health and former co-director of the Yale World Health Organization Center for Health Promotion, Policy and Research. Professor Ruger is working to promote the creation of public health programs that make more efficient use of scarce resources while improving current health care practices. The Institute of Medicine recently invited her to testify about how the management of global health institutions and governance might be improved. Professor Ruger is here today to talk about the IOM report on global health and share some of her insights. Welcome, Professor Ruger.
Thank you.
Healthcare in the United States today is complicated. There are huge disparities, and a solution to those problems seems elusive at best. Why look at global health?
Well, especially in these economic times, it would be certainly prudent of our government to focus on the healthcare system here in the United States. And there are, as you indicate, a number of disparities in healthcare, in access and financing in the United States that are differentially impacting the American citizenry. However, if you look at the U.S. healthcare system within a global perspective, we see that compared to many developing countries, the United States healthcare system is actually quite developed and quite strong. For example, the expenditures for an individual on healthcare in the United States are over $5,000, whereas in many developing countries we're talking about $100 or less, and even as low as $10 per person in healthcare spending. Also, we see major differences in the healthcare infrastructure in developing countries versus the United States. For example, the number of physicians or nurses per person or per 1,000 people in a population are significantly different by even 100-fold in the United States versus many developing countries. And on. There's a number of major differences between the healthcare system in the United States and in many developing countries. Alongside that, we see a major significant difference in the burden of disease in developed countries in general, in the United States in particular, and many developing countries. For example, life expectancy differences. In the United States, on average, Americans live over 70 years. And in many developing countries, especially in Africa, the life expectancy is less than 40 years or 45 years. So the major differences and the scope of the problem of the healthcare system at the national level, even though we have great problems in the United States, is quite significant in many developing country contexts. So the United States is interested from a global perspective in how it can better engage with the global community to improve health systems in developing countries.
The IOM report to which you contributed addresses the question of how the U.S. government can improve global health under the new administration. Share with us some of its findings.
Well, the Institute of Medicine recently convened a committee and a set of working groups to focus on different areas of global health in which the United States can contribute. Some of the main issues that this committee was looking at in the report recommendations outline around several key issues in global health and the U.S.'s role. The first is the U.S. Having a major role in global health as a component of foreign policy, as a component of U.S. foreign policy. And the recommendation from the report in that domain was to actually enhance the U.S. role in global health as a major strength of our U.S. Foreign policy. The second major area of recommendations from the report was in the area of global health financing. And the recommendations in the report were along a number of different areas of financing. The first was to actually increase the amount of money that's invested by the U.S. government in developing countries in global health, either multilaterally through the global health system of global health institutions, or bilaterally directly investing in global health from the United States to another country. The recommendation by the report was actually to double the investments from $7 billion to over $15 billion in the new administration. Another area of financing that the report focused on and recommended was that the actual portfolio of investments in global health change somewhat significantly. So an emphasis was placed on, with this increase in investments, spreading the investments around different diseases. So not just focusing on just a particular disease like AIDS or malaria or TB, but focusing on the infectious diseases and the non-communicable diseases that contribute to the greatest burden of disease in many countries. Another area was of recommendations in terms of funding was around strengthening health systems in developing countries and focusing particularly on financing and human resources and the infrastructure. The third area of recommendations for the report was around governance issues, both within the United States in terms of its commitment to global health and global health governance. So within the United States, a recommendation was made to coordinate better the different policies and programs that the United States has in global health. So when the Centers for Disease Control is doing something, and the U.S. Department of Health and Human Services is doing something, and the State Department, that we actually have some sort of a coordinating mechanism. And actually there was a specific recommendation to create an office and a position within the White House for global health. So more coordination, a more coherent strategy within the U.S. Towards investments and work in global health. And then on the global health governance dimension, a recommendation was made again towards greater coherence. So the U.S. would engage with the global health community primarily through the World Health Organization or another major coordinating mechanism, so that the United States, along with other countries and other different programs in global health, try to coordinate and align the investments in global health to have greater impact. A final area of recommendation was in investments in health-related research, that the U.S., through the Fogarty Institute, the National Institutes of Health, other areas of health-related research, has actually been very beneficial in focusing on coming up with new discoveries about diseases and how to prevent them and treat them. And so an emphasis was made on improving and enhancing our investments in research related to diseases in the health systems of developing countries.
Sounds like a lot of good recommendations. Initially you touched on foreign policy. Why should healthcare be one of the foundations of U.S. foreign policy?
Well, this was an area of the discussions among the committee that I found to be the most interesting. There seems to be a greater shift in thinking about health as a foreign policy issue now than there has been in the past. In particular, previous work in global health has really emphasized health as a part of U.S. foreign policy in terms of America's self-interest, or why would America or Americans be interested in promoting health in developing countries, and why should that be a part of our foreign policy from our perspective in terms of national interest. And that's still a major component of the rationale for why the U.S. should be involved in global health. But it seems like there's a shift now more towards the global interest, and that the U.S. should be involved in global health, and global health should be a part of our foreign policy, because the U.S. as an economically developed and one of the more economically developed countries, a leader in global diplomacy, has a responsibility and opportunity to enhance the global interest of reducing the disease burden in many developing countries. And that actually is more of a long-term view, that if America focuses on health as a foreign policy issue, that global interests will be enhanced, but also American interests in the longer run. And what does that mean? That means that investing in health is good for economic development in developing countries, which is ultimately good for the United States and for the global economy. Investing in health is good for security. It's better for peace. And we see many areas of the world where there are major disease burdens and there's a great deal of civil conflict as well. So investing in health is good for security and peace at the global level, but also for Americans. And that these ideas of investing in global health are also founded in ethical commitments, that it really is the right thing to do for America. So it's a very interesting, having seen this over a number of decades, a very interesting shift in the rationale for why the United States should focus on health as a foreign policy component.
Mm-hmm. And who controls global health policies now?
Well, global health policy is a very vague concept. It's there's a lot of groups, institutions, individuals, countries that are involved in global health. One term that we typically use to describe global health policy is the global health architecture. So what are the different institutions that are involved in global health? I would say first and foremost is countries themselves, national governments, ministries of health, and ministries of finance that support ministries of health and fund the health systems and public health programs in developing countries. So I think this is often not as emphasized in the global health architecture, but national governments, national health programs, and at the subnational level, state and provincial governments are important in the global health architecture. At the global level, we have a number of different global health institutions, and that is another area that has changed significantly in the past, even in the past 5 and 10 years, and particularly in the past 5 years. We've seen an escalation of the number of players and actors in global health. We used to be that at the global level there was more or less the United Nations system with the World Health Organization, UN-AIDS, and other UN agencies, the World Bank, and now we see a plethora of different institutions involved. We have the Global Fund, there's the PEPFAR, the President's Program for AIDS, we have the Gates Foundation, a number of private entities involved in global health, civil society, NGOs. I mean, it's just an enormous number of different institutions and actors, both on the funding and the financing of global health, but also in the implementation and the program development and policies on the ground. So one of the key issues that was addressed in the report, and that's why the World Health Organization was recommended as a coordinating mechanism, was that in many respects, and we're actually seeing this in the evidence now, at the country level, a pluralism in global health financing and program development can be burdensome to countries. It can be very difficult to manage a number of different donors and with different agendas and working at cross purposes sometimes. And so an effort was made, or a call to action was taken in the report to try to find a coordinating mechanism for trying to really bring together these different institutions and players around shared objectives. And I think that goes back to the ethical commitments and also the global interests that were the foci of the report that really all these different institutions and players are to be in the global health architecture to improve health in developing countries, and aligning our efforts around that shared goal can create greater impact. Along those lines, an emphasis was made in the report with respect to the global health architecture and to U.S. commitments in global health to try to measure the impact of the U.S. programs in global health and other entities in the global health architecture on health outcomes. I know that sounds very obvious, but that has not typically been the case in looking at these programs. In financing and donor development, for example, typically the amount of money spent or a loan that was dispersed had been the measure of success or the measure of progress. And that's not really the final end goal. The end goal is to reduce disease burdens, to improve life expectancy, to reduce infant and child mortality, to improve the prospects of a pregnant woman in terms of her mortality and morbidity outcomes. So these are the measures of success that the international community has to align itself with in the future years.
Okay, so you have highlighted several of the recommendations that the report makes. How realistic do you think the recommendations are?
Well, I think the report and the committee at large had a very nice balance, healthy balance of idealism and realism. Idealistically, there are some major goals that need to be achieved, and as I just said, the focus is on health and the health impact. And along those lines, the Millennium Development Goals, the MDGs, are dimensions of the measure of the health impact. So child mortality, infant mortality, maternal mortality, the disease burden in terms of HIV and AIDS, malaria, tuberculosis. So, there are dates by which the global community has suggested that we, in the broad sense, achieve these objectives, and those are difficult objectives, but they're idealistic in some sense, but they need to be realistic in the sense of really motivating people and organizations to move forward towards them. The more organizational efforts, and there are a number of different factors that are at play in terms of achieving health outcomes. So it's very difficult. Sometimes that's very difficult to measure and attribute health impact. The organizational, the governance objectives, I think, are very realistic. I think that the United States has identified through this report for the new administration ways in which it can reorganize and coordinate and hold itself accountable. The new administration is very focused on outcomes and transparency and very pragmatic in those ways. And I think this fits very nicely with those objectives. So I think that's very realistic and it can definitely be achieved. Similarly, the financial commitments certainly can be achieved. A doubling from $7 billion to $15 billion, not that that's small change, but and we have a scarcity now with the current climate, with the economic crisis and the current legislation that's being considered. But that said, we're seeing that we've seen some early signs that the current administration is interested in global health and has some knowledge of some of the issues, and I think has shown a commitment, and I think it is fairly realistic to assume that that administration will take on that particular recommendation. I also think that in terms of the portfolio and focusing on the broader range of diseases and the health system focus recommended by the report, that yes, that would fit very much with the new administration's broader sort of view of things, and in particularly results on the ground.
Okay, so you're optimistic that the Obama administration will be able to implement the recommendations, so there is hope that there will be an improvement in global health?
Well, I think that, yes, I think that I'm optimistic about our current administration, and I'm also extremely optimistic about the overall global climate. Mm-hmm. In the last 2 decades, I don't think I've ever seen a time where there's been so much enthusiasm towards global health. We've seen doubling of investments financially. We've seen, again, the introduction of a number of new institutions and players. We've seen, so enthusiasm, I think, is quite ample. That's why the governance issues are so critical. It's really trying to coordinate and bring people together on the same page to achieve the results on the ground. But I do think, yes, I think the U.S. the Obama administration and also the global commitment that we're seeing is ripe for the implementation of a report like the IOM has just pursued.
Wonderful, that's good news. Thank you so much for being here with us today and sharing your insights on the IOM report. For more information about Professor Ruger, her work, and the IOM report, please visit our website at yale.edu/Macmillan Report. Be sure to join us again for another episode of the Macmillan Report, made possible through funding from the Whitney and Betty Macmillan Center for International and Area Studies at Yale.